hyperbaric oxygen is causing oxidative stress at very high levels. Normally, you'll be surprised, hyperbaric oxygen is used for horses also. Veterinary, there is a big room for that. The horses which are being used for the races and all that, and that is big. And the other application is the sports also. You give more than 3 ATA, 4 ATA pressures where we can induce a lot of oxidative stress. In our general practice, we don't go up to that levels. We don't, already oxidative stress is higher in all of us. I can always tell you, every one of us is having a high oxidative stress nowadays. We don't want to meddle with that anymore. Upregulation of enzymes happens, antioxidant enzymes with hyperbaric oxygen. That's the way it helps as such. It's a 1 hour treatment, and this antioxidant enzymes, glutathione and all that, again, we are all deficient in this particular stuff. And mitochondrial function, which improves with hyperbaric. There were some pediatricians also wanted to come, so I created this slide for them. It is used for this all autism and all that. Rakesh, I was telling about a center in Moscow which has got birthing chamber. The high risk kids, the high risk pregnancies are being subjected to birthing in, they do a delivery in that hyperbaric chamber operation theatre, so that the child comes out and he will not have any hypoxic insult. So we are preventing cerebral palsy. Audiology, ENT, idiopathic sudden deafness, we have worked out with one case actually recently from a high software professional, about 30 years old professional, and he was having sudden loss of hearing, and we worked on so many things as such. Finally he was, we could get very good results with this guy, but still we are not able to understand why this guy got into this kind of hearing loss. We are saying 30 years old, we are still not able to explain what is the cause. Maybe the Wi-Fi, there are so many things which have taken over, and the technology, we are paying a huge price for that. And I was able to tell that software guy, techie, that, and he stopped using Wi-Fi. He was so proud, he was telling, I use Wi-Fi 24/7. And once he got that particular thing, this was a study for idiopathic sudden sensorineural hearing loss and hyperbaric oxygen along with steroids. They do some good response. We need to look at some of the things as such. The more the acute case, the response is quite good. Parkinson, we have done 5 patients. There are some doctors, father also, we have done it. I can always tell you, this is one territory where we can prove it. We will give you some injection glutathione along with that hbot, and he has to improve. Only thing is how much and all that it takes, what is the duration of the disease, it makes a difference as such. But we are very sure about this Parkinsonism as such. There was an 82-year-old diabetic, and with a 15 years, even if for that 80-year-old person, if he starts tremors are decreased, it makes a hell lot of sense for that guy. And I can always, we are very, very keen to work with patients like this. And this was a case study I have taken from a journal actually, one of our this one, and wherein acute ischemic stroke, and it has to be like this, after 6 hours you can't give TPA and other things as such. After 6 hours it becomes irrelevant. So these are the cases where hyperbaric oxygen can help in a big way. We had most of the cases are chronic paralysis cases as such. And yes, Dr. Vijayalakshmi, this is one of the things which we wanted to show as such. As a endometrial infertility cases, I was talking to Dr. Nilima also. Cases with endometrial is very thin, and it's a primary infertility, wherein Doppler showed the resistive index are very high. There is no receptivity there. We can always work by giving. There is a paper which was presented, and they had shown diligently working with hyperbaric oxygen for 5th day after menses, and if you do it for 8 to 10 days, we were able to show the difference in the RI, resistive index of this one, and endometrial thickness also it improves as such. This is one of the studies. I can always give you that data also, ma'am. Plastic surgery was also expected here, and again non-healing wounds is their territory, but I have been working with a lot of plastic surgeons now, and we were able to they were able to do a good flap surgery. The skin grafting becomes very easier now. Cancer, and yeah, there is all radiotherapy cases, post radiotherapy, there is a good role for hyperbaric oxygen, and I don't want to go into details and all that. Still, I was expecting some oncologist also here. The timing and all that didn't suit. I'll just go very fast about that. One of the cases I had done from KIMS Hospital. One of my friends, Jagan Mohan Reddy, sent me the case of hemorrhagic cystitis, and hemorrhagic cystitis, it was not controlled by anything, and this was a case on ultrasound. The thickness of the mucosa of the bladder was about 12 or plus millimeters was there. Patient was into absolute distress, female lady who got post cervix cancer radiation. She had, the bladder was very thick as such, and she had a big issues going into recurrent, every 10 minutes she used to pass urine, and we did this case, and maybe around 10 or 12 sessions the patient went back normal. These patients are from Nizamabad, and post-surgical brain edema, again this is one of the indication as such. People neck surgeries and throat surgeries, and it was shown that people who were doing along with hyperbaric oxygen, the response rates was very good as such. So the bottom line here is, this is not a total therapy on its own, but it can be a good adjunct when it combines with radiation and other things as such. In cases of, I told this guy also, yeah, there was a hepatic surgeon as such, Mahajan. The thing is, you can always work on hepatic cases also. This was, in fact, this was a study which was done from Japan, and they evaluated about 41 patients, and they showed people doing hbot before having good response. Radiation proctitis and all that is quite, but I would like to say something about high-grade gliomas. We had worked with one patient. That patient was called Sanjay. He is no more, and he had a glioblastoma multiforme. And glioblastoma multiforme, operation was done. He was post radiation, and he went on to, we did some kind of therapies. He was not able to come to that terms, lie down and all that, but he had a good quality of life in the last days. And sports medicine also, there is a word called performance enhancement product. We were all we want to see that our performance levels always goes up. Even everybody is working on that, but I can always tell you, you don't need steroids and you don't need anabolic things as such. Just do with this hbot, and we were trying to work with one of the cricketer also here. There is a occlusion of, this is also a very good indication, sudden blindness, and wherein this can be a save. I'll just show a few of the cases and we can wind up and we'll have some small discussion about that. This was a case, lady referred to me for hbot from Yashoda Hospital, and she was a diabetic with insulin dependent diabetic, and she had a trauma, and the heel, this is the portion of the heel. There was a wide, deep cut actually, and nobody wants to touch that particular stuff. They did try vacuum and all that, but it didn't work out. We started hyperbaric oxygen, and touch wood, we were able to arrest there was no ooze and all that. Immediately after day 3, there was no ooze. Even though she was kept on all antibiotics, everything was kept, and we went on that, and this is on this day 12, this happened to be 3 days back only. She is still with me, And only thing is, his son he's from US, and he worked out everything. He was the guy who told the doctor, no, I want hyperbaric oxygen. That's the reason he came. And touch wood, she is a teacher, 65-year-old teacher, doing phenomenally well. Now she's able to put the kind of she's able to walk now. She came to us on a wheelchair. This was a non-healing ulcer with cellulitis, and this man again is some big shot, and he was really not happy at all. Somewhere around 80, 82 years, some young family was there, and he was not getting better. We started doing hbot, and this was the result. It hardly took us 1 week time, and this was a case of engineering student. No, she completed engineering also. She presented with gangrene in the left 3 fingers, and it was, you can always see that particular thing, and she gone to almost all the places. She was advised to go for amputation, and she had a cerebral problem also, and we were able to do some kind of hbot. Along with that, we did some other stuff as such. Other stuff I like to come, we did something like chelation therapy for that, because Takayasu's disease, particularly assay, it was because of mercury, and this girl had a teeth filling, and the teeth filling which was having mercury in that, which was probably causing all these problems as such. We went on, there is no biological dentist here in Hyderabad, but some people are doing that. We removed that dental fillings, and she is now almost quite better. We removed it, did chelation, did hyperbaric oxygen, and this is kind of thing. Now this girl is called Sharanya. She is into teaching profession now. Absolutely, that all 3 fingers, which was almost, everybody said it's gone. Some other cases, Rakesh, Dr. Mishra sir, it's your day-to-day practice. But these are the things which really once we do at least 5 or 6 sessions also, they start getting the difference. I can go on and on, but I just wanted to show you some simple stuffs. This was a case of sebaceous cyst. One of my relative was operated on a sebaceous cyst. They had taken out 4 sebaceous cysts on the chest wall, and after resection, it was not healing. He tried everything on earth, and then we started on thing. This is a case of E.D. Prasad also was expected. He didn't come. That was E.D. Prasad's case, and with hyperbaric oxygen, it worked out well. It was not just hyperbaric oxygen. He went on with some vitamins and other therapies also. He took a lot of zinc and all that. But non-diabetic, non-hypertensive, a 56 years male with non-healing. There were a lot of things. He was subjected for tuberculosis treatment and so and all that. I think I will wind up here. I don't want to go further as such. And this is what we are trying to work it out here. And this is again a fistula in ano, where that also one of the fistula has disappeared. This is an interesting case. I'd like to give one brief thing about. This was diagnosed as pneumointestinalis. I was discussing with Dr. Bhargav also. The patient was, laparoscopy was done for a suspected hollow viscous perforation. They could see air under the domes of diaphragm. And after opening the abdomen, they could see there was some blebs of air into the transverse colon and all that. So this was called pneumointestinalis, very rare case, sir. And they asked me whether you can do a hyperbaric oxygen. We did for almost, I think it was 4 days. The patient was carried from Asian gastroenterology to our center with 3 or 4 nurses, 1 surgeon, and it gave us also a good kind of thing. My patient, they said, "Arey, he's doing something good." But I must tell you, it was a tough thing as such. We started working. This was the previous report when they did a laparotomy. They showed it was pneumatosis involving mid-jejunum to distal ileum. Right. So this is the patient is called Loitharity. We did it for 3-4 consecutive days. Patient started improving, and the surgeon went on for a relux surgery. I said, you can go for a CT scan. He was very keen to go for a relux surgery, and he did a relux surgery, and he mentioned pneumatosis which was there totally It was not totally resolved, but he said on his words, Karnak Reddy said it's 80% reduced, man. So this was the kind of thing. We still are working out. We are getting some different cases. There was a fistula, but somehow this is a for us, for me particularly. I started with hyperbaric oxygen, working with autism and cerebral palsy. I was not knowing the kind of myriad possibilities, but I can always tell you, it's always nice to be working with this kind of modalities, and I definitely like to involve, because I don't want it to be, as Jairaj I told you, I don't want to be more or less. We are still in a learning phase. We still want to do something better and all that. And I've been working on. I went for hyperbaric society. I went into the chamber, tried to see what are the things and all that, get some certifications and all. But again, I can always tell you, nothing like a practical thing. What Dr. B.K. Sai must have seen, for us, our professor, and he must have seen. And you have something to say, Dr. Bhargav sir. Because I just tried to be, I thought, let me be very brief, cover up the whole thing into something. It's like, Ramu.